Shaw TV is your home for Calgary's live civic election coverage. Join Shaw TV Channel 10 October 21st for the Countdown Show beginning at 7:30 and live commercial-free coverage beginning at 8 p.m. Live coverage, live results, live reactions. Election 2013, as it happens. October 21st, airing on Shaw TV Channel 10. Your voice in the community.
Hello animal lovers and welcome to Critter Care. I'm pet guy Robert Church and I'm so happy you could join us today for Vet Talk on Critter Care. We've got Dr. Jill Johnson with us from the Country Hills Vet Clinic right here in Calgary. We're going to be answering some of our viewer questions and we're going to help you understand some of the common veterinary practices. Things like why we need to spay and neuter our pets, what the vaccinations that we give our pets are for and what kind of diseases they prevent, and preventative treatments for some of those funny little things that get inside of our pets that they pick up when they're sniffing around in the park. Also, this is really important from a vet's perspective. We want to help you to prepare your pet for a trip to the veterinarian because a lot of times it's quite a change for our little dog or our cat. So we're going to talk about some of those things and some of the preventative measures you can do at home to keep your own pet healthy and happy. We'd love to hear from you here on Critter Care as well. You can like us on Facebook at Critter Care with Robert Church. We'd love it if you would send us any pet photos, pet videos, any questions or comments that you have. Gentle criticisms would even be acceptable, although I may delete and ban you if we have to. But we'd love to hear from you. Any suggestions about the program, we'd love to hear. So let's get busy. Dr. Jill Johnson from Country Hills Vet Clinic, thank you so much for joining us today.
My pleasure.
And you've been at Country Hills and you've been practicing. You've been a practicing veterinarian for how many years?
13.
And where are you from? Tell us a little bit about yourself.
I'm from the UK. I originally grew up in a small place called Hollywood, just outside Belfast in Northern Ireland. And I trained to be a vet in London, England. And then came over to Canada 6 years ago.
And this was at the Royal
Veterinary College, which is part of the University of London.
It must be ancient then. It must be one of the first vet colleges in the world.
Probably is.
Yeah.
Certainly was the first one in the UK.
Yeah, okay. You know, we talked a little bit about, I'm sorry, why did you come to Canada?
Because we like skiing.
Not,
we spent every year coming here on holiday and we decided why not just move here and have it as our backyard to play in.
That's great.
So,
welcome to Calgary.
Thank you.
13 years, not really new. We were talking a little bit before the program back and forth about, you know, this is such a broad topic and where do we start? And hopefully you'll enjoy this so much you'll come back and do another show with us so we can cover more things. Because there's so much that we can talk about. And we were struggling a little bit to prioritize what we were going to talk about on the program. And so I thought maybe we could just do things in a little bit of a linear fashion. Let's start with a puppy. Let's go through sort of the medical milestones of this puppy's life. And then we'll do the same thing with kittens. And then we'll do some viewer questions and we'll go from there.
Sounds good.
So tell me about a puppy. How, at the beginning of their life, what is their immune system like? What are the things that a veterinarian needs to do to keep them healthy and protect them from some of the pediatric diseases?
Well, whenever a puppy is first born, the first 48 hours or so, the mother is producing a really thick, nutritious milk called colostrum, and that's full of antibodies. And those antibodies are what is going to be its immune system for the next 4 months or so. We don't know how good that immunity is. Some mothers give a very good, strong immunity, some don't, and that's why the initial puppy vaccines are so important, because if they haven't got a good immunity from their mother, then the vaccines give them that immunity until they can build their own, and then the vaccines later on will actually last.
So we've got a puppy. before it even comes home from the breeder should be giving it vaccinations then?
Often they do, yeah. They can start the vaccines from about 6 weeks of age.
And what are we vaccinating? What types of diseases are we vaccinating against?
The main combination vaccine is against distemper, parvovirus, adenovirus, which is a form of infectious hepatitis, and then paroinfluenza, which is part of kennel cough.
So, okay, so tell us a little bit about each of these diseases. What is distemper? We all have heard about it, and I know it's really bad, but I don't quite know how it manifests itself or how contagious it is.
Thankfully, we don't see that much distemper these days because the vaccines are very good and enough people are vaccinated, enough animals, I should say, are vaccinated. But it's a multi-organ disease that can present itself in numerous different ways. And if you get an acute form of it whenever you're a young dog, it can kill you. If you're lucky enough to survive it, then you can go on to have longer-term effects right into old age. So it's not a nice disease to have. It's much better to prevent it.
The other ones?
Parvovirus is something that we see a lot of in Calgary. It is an acute hemorrhagic, which means bloody diarrhea with vomiting, and again the animals can die very quickly, and it's very common in unvaccinated puppies. Older dogs get it too if they're not vaccinated, and it actually tends to be even more serious in the older dogs. You can get puppies through it easier than you can get older dogs through.
It is a horrible virus.
Horrible.
And it's also very present in our environment. How is it transmitted?
It's transmitted through the puppies becoming in contact with the virus, either from the environment itself, because it stays in the environment for a long time, or from other infected dogs.
So is it safe for us then to take our puppies out to off-leash areas or to the park?
We don't recommend taking the newly vaccinated puppies to the off-leash parks. It's better to wait until they've had their full vaccine course, because the off-leash parks are probably one of the biggest risk areas. If you've got friends and family that have healthy vaccinated dogs, we want your puppies playing with them. They need to socialize. It's really, really important that they get out into what their world is going to be, to learn about it before they're 12 to 14 weeks of age, because that's the easiest socialization time. But we don't want them given the biggest risks, so we don't want them taken to the off-leash parks.
Right. And our course of vaccinations are going to be, how many vaccinations are we going to give our pups? 3
or 4, depending on what age they start at. If they start at 8 weeks, then they'll have 8, 12 and 16 week vaccines. They're done roughly 3 to 4 weeks apart. We want to finish at about the 15, 16 week time, because that's whenever the maternal immunity is run out, and then we're stimulating their immune system. Before that, we're just kind of giving them a help to not get the diseases, but it doesn't last.
So vaccinations, are they sort of cumulative then? Like the 8 one kind of builds on the 12-week one, or it stimulates it?
The 8-week one, we're not really stimulating the puppy's immune system at that stage. You're almost just giving them protection against the disease, which can't last, because the maternal immunity is what we call passive. It can't be stimulated. You've got to wait for the puppy's immune system to mature enough to stimulate it. And then whenever you've got the older puppy vaccines, as in older than 12 weeks, 12 and 16 weeks, then you're starting to actually be stimulating that puppy.
So from a veterinarian's perspective, what is the latest I would take a puppy to see a veterinarian?
I would take a puppy within the first week or so of actually rehoming the puppy, because there's a lot more to the vet check than just the vaccines, because you want to have a general overview. Is that puppy that you have adopted healthy? Is there anything that that you need to know about before you've fully bonded with the pet? Because there's occasional times whenever we find stuff that make you decide that you don't want to keep the puppy. It's very rare, but it can happen. So you want to have that check as soon as possible.
Some little bugs too that get into our pups, Coccidia and Giardia, are internal parasite,
yes,
aren't they? That,
yes.
That again, very present in our environment. How do we protect against that?
Well, again, the breeder or the pet store may well have been doing a deworming protocol before the owner gets them, and then we would continue on with the protocols against the parasites.
So you just an internal worming medication, or
Yeah, we tend to be aiming mainly against roundworms because that's what the majority of puppies come with, and it's nothing to do with how good or bad a breeder is. It's just a fact of life that puppies are likely to come with roundworms.
We will continue this line of questioning after the break. Dr. Jill Johnson is with us from the Country Hills Vet Clinic, and we're talking about puppies and caring for them and vaccinations and just some of the things. We'll talk a little bit about rabies and spay neuter and everything when we come back. I'm Robert Church, and this is Critter Care on Shaw.
11 million people in Eastern Africa suffer from the worst drought in half a century. Food and water are scarce. Families have begun to starve. Children and elderly fight for their lives. Humanitarian coalition members on the ground provide food, water, medicines, and shelter. Your donation will save lives and prevent this disaster from getting worse. Call the number on your screen or donate online at together.ca. Please act now. Every moment counts.
Welcome back to Critter Care. I'm Pet Guy Robert Church, and Dr. Jill Johnson is with us from the Country Hills Veterinary Clinic, and Kala, the Golden Retriever, has joined us. You know, we just got to the really interesting roundworms part. We were talking a little bit about preventative vaccinations and parasites. We do preventative medication for worms, too. Why are worms such a concern, other than the fact that they're so hideously gross and disgusting that they actually turn my stomach?
Really? They turn their stomach to you, do they? These are two examples of the worms, just to turn your stomach. These are roundworms, and these are tapeworms. So these are the types of worms that puppies come with. The roundworms are the more common one, and the problem with these is that they can make the puppies very sick. But as well as that, they can pass on to children and cause disease in children. So we're deworming our dogs, not just for the dog's sake, but for public health as well.
Where do the worms come from?
The worms come from their mothers. It is just part of the pregnancy and life cycle for the mothers to actually pass worms on to their puppies. Okay. And then they mature in the puppies, and if their immune systems aren't that good, then they get a bad burden of them, and that can make them very sick.
How big do tapeworms get? Do they get to be like 2 feet long?
They can be. This is probably a pretty small one.
Oh boy. Yeah. And there'll be dozens of them or hundreds of them?
It varies. Each case is individual.
Okay, so let's keep our animals well wormed here, because I sure don't want to see any of those. A couple other things before we go. Before we move on to Kala, we strongly recommend spaying and neutering our pets.
We do.
Just a couple of the benefits of why we want to do that.
Well, number one, I suppose, is to prevent unwanted pregnancies and to prevent unwanted puppies. There's enough unwanted dogs and cats out there. Mm-hmm. The shelters don't need any more. And the other is to prevent some pretty serious illnesses in the dogs. So we can prevent mammary cancer, which 50% of them spread and can kill the animals. We can prevent something called pyometra, which is a horrible womb infection, which they get later on in life, which makes them very sick. And also, a lot of people don't want to have the hassle of having a dog in season.
Right, of course.
So,
Kala, come on back up here. We need you for this part now.
Kala, good girl.
Because we want to talk about what people should do to prepare to go to see their veterinarian. And so this is the demonstration part of the program. So Dr. Johnson, what are we going to do with our pets at home so that when we take them to the veterinarian, they're not going to be all freaked out?
Well, whenever we're examining them, obviously we're handling the animals in a way that can be quite foreign to them. And so just getting them used to having things looked at, just getting them used to having their eyes looked at, having their lips lifted, to be able to look at their teeth. Good girl, Kala. Show how big teeth you have. Look how beautifully white they are as well. Good girl. Getting them used to having their ears looked in, because again, doing something like this to some animals can be very scary. Getting them used to having their feet handled, especially their nails, because a lot of dogs hate having their nails.
Sure, I think that's one of the biggest problems people have, is they don't mess around with their pets' feet enough.
Well done.
And then when you go to clip their nails, they
freak out.
They freak out on you.
Exactly.
So we want to be really careful about that.
Well done.
And what should people do? Because I think what happens is a lot of times people go in and they have a whole bunch of questions.
Well, it's a good idea to write them down before they come, because a lot of people consult their lists whenever they get in to make sure that they've got everything. And there's nothing more annoying than knowing you have a question and not being able to remember what it is,
Yeah,
which happens too frequently. So it's a good idea to write them down beforehand.
How often should we be taking our pet to the veterinarian, and what kind of ongoing vaccinations are we going to need for our dog?
Well, after we've done our puppy series, which also includes rabies, which is done roughly about the 16-week vaccine, and then we can also do a kennel cough vaccine. After those, then we do the first adult vaccines a year later, and then vaccines are done every 1 to 3 years depending on what vaccine you have and what brand it is.
But we should be having our pet examined every year?
Every year, yeah,
All
because
right.
we're looking for stuff that that owners aren't expected to be able to find, whether that's dental disease, ear disease, heart disease, joint disease, lumps, all that kind of stuff. It's amazing how much we can find that people don't know is there.
How soon are we going to start seeing dental problems in our dogs?
85% of dogs over 1 year old have some form of dental disease.
Yay.
So it is something that most animals have.
And is it just because they're not getting the fluoride in their drinking water? Or does fluoride help a dog's teeth?
Dogs don't get caries like we do as much. We get a lot of our dental disease because we eat a lot of sugar. And that's where it comes from, where dogs' dental disease is more because they don't have as much dental care as we do.
I mean, in the wild, they're not brushing.
They're not, but they're eating a lot of, they're doing a lot of ripping and chewing and tearing whenever they're eating live prey, and that does a lot of cleaning for them.
I suppose wild animals don't have perfect teeth either.
They don't, and they die a lot younger than our animals do.
Right.
So.
But I would think that it's probably one of the most important things that we can do to improve the quality of life for our dog is...
It's something that you can make a huge difference on. A little bit of time, a little bit of effort, and your dog can have much healthier teeth than those owners that do nothing.
So brushing our dog's teeth, giving them proper chewing
Brushing
things.
is number one, and then chewing is a very important part of that afterwards.
I see that we've got one of these. Is this a nylabone? Looks like a nylabone. Yep, nylabone, which all the books recommend, all the vets recommend, and she's chewed that up. And I guess the idea behind nylabones is that that's going to grind on the outside of her teeth?
It's grinding on the outside, yeah. But the other important thing is it's not breaking off in chunks.
And not breaking off in chunks. And this will help keep her gums healthy and stimulated.
Definitely.
And they get most of their problems on the outside of their teeth, don't they?
They do, yes.
Right. Kala, come on back here.
Come here, Kala. Are you going to show us your pearly whites again?
Yeah. Oh,
Good
she's so
girl.
gorgeous, huh?
She's a really good dog.
And she's young. She's 7 or 8 months.
She's about 7 months, yeah.
Okay. Well, why don't we take a break? And when we come back, we'll talk a little bit about some of the geriatric situations that we deal with, because our pets are living longer and longer now, and later stages of life for dogs and cats are very, very important to maintain their quality of life. So Dr. Jill Johnson from the Country Hills Vet Clinic is with me today. We'll be back in just a minute. I'm Robert Church, and this is Critter Care on Shaw.
Shaw TV is your home for Calgary's live civic election coverage. Join Shaw TV Channel 10 October 21st for the Countdown Show beginning at 7:30 and live commercial-free coverage beginning at 8 p.m. Live coverage, live results, live reactions. Election 2013, as it happens. October 21st, airing on Shaw TV Channel 10. Your voice in the community.
Welcome back to Critter Care. I'm pet guy Robert Church, and Dr. Jill Johnson is with us today from the Country Hills Vet Clinic here in Calgary. Kala the Golden Retriever. We've been talking a little bit about puppies and puppy care. I know if you saw, we're at the top of the show. I said we were going to talk about cats and all this stuff. We just have gotten too much into this, and we want to do a little bit of show and tell. So we're going to ditch the cat stuff for another show, and we're going to talk a little bit about how you can brush your dog's teeth at home, and that will help keep the dental health a lot better. And this is interesting. This is a canine tooth from a dog, correct? And so when you have to do an extraction, you think, oh, I just got to pop it out. Well, no, not really, because that's a big tooth. It's like the tip of the iceberg. And when you have to do a surgery, all of a sudden it's a big job. Mm-hmm. Do you get a pair of pliers? Is that how they come out?
People don't realize how long it actually takes for us to extract dogs' teeth. The canine is the biggest one, and we actually have to do take out a chunk of bone to be able to actually take it out. But the other teeth, lots of them have multi-roots, and so we actually have to divide each tooth and take each root out individually. So it takes a long time.
Big job.
Big job.
Okay, well now let's get
into prevention.
Calla, come on, you. We gotta brush these teeth.
Good girl.
We got to keep these canines nice and clean.
Good girl.
The treat is there.
Good girl. There we go. Okay.
So how do we get our dogs just used to the idea that we're going to brush their teeth?
Well, we try and make it fun. That's the biggest thing. They've got to actually be willing to allow it to happen. And we do it with a lot of rewards. Calla, come here. The first thing is just to even get them used to having their mouths handled, like we talked about earlier.
Sure.
And just lifting their lips. And so you literally, first day, that's all you have to do, and you give them a treat because you want them to realize that it's a good thing. And then the next time you do it, you try and lift their lips a little bit more and even rub your fingers on the teeth, and then trying to get right to the back of the mouth. And if you do your fingers first, then they're less likely to chew on them than they are an actual brush. And then as the next thing, you can get a finger brush, which is good for training but isn't so good on a longer term basis.
Oh, those aren't the best ones to use.
No, the bristles aren't long enough. So if you look at a regular brush versus the finger brush, these just kind of brush the surface. They don't get into the grooves, but they're good for training. Good girl. So you just get them used to you having your fingers in there, and again trying to get right to the back. Good girl, you're being such a good girl.
You don't need to worry about the inside of the mouth?
You don't do the inside, you just do the outside, because that's where the worst disease is. And the worst disease in teeth is going to be these big, huge, this carnassial, the big tooth at the back, and the big molars, because that's where the salivary ducts dribble saliva all the time, and they get to be the worst.
And it seems like it's always on the gum line.
Yeah. The gums get gingivitis, which is inflammation, and that's through bacteria being trapped against the gums. And the gingivitis can be painful for the animals and to cause the gums to bleed. And then as well as tartar, then you can also get that they get some bone loss, which is shown up through x-rays. And you can get loosening of the teeth, and you can get abscesses, again, shown up by x-rays. All stuff you don't want. It's far better to prevent.
And it just, mouth pain has got to be just about the worst thing to affect your quality of life.
Animals are so, well, stoic for a better word. If they don't eat, they die in the wild. And so an animal will eat until it really has no option. So they can have a lot of pain without you realizing it. Some people, with the dogs with the worst mouths, they have the dentals done, they have multiple extractions because that's what's needed. And the dogs are different dogs afterwards. And owners come to us and say, we never realized it was such a problem.
It changes their life.
It changes their life, literally. And owners wish they'd done it years before. But brushing is #1 for prevention.
Can they get, do they get low-level sort of bacterial infections going through their whole bodies because of?
Tartar traps bacteria against the gums, and if the gums are liable to bleed, then that can allow bacteria into the bloodstream, and yes, it can go around the rest of the body, and it can cause low-level disease elsewhere, or it can really affect some other diseases. If you have diabetes and you have a bad mouth, your diabetes can be completely unstable purely because of your mouth.
Right. Brushing your dog's teeth isn't always going to be enough, though. At some point, you're going to need veterinary intervention.
In an ideal world, it is enough. We have some 10-year-old dogs that have perfect teeth, but those owners are exceptionally diligent. The majority of animals also need us to intervene with our dentals, and we do scale and polishes, ideally as a prophylaxis, which means that we're doing it to prevent worse disease. We're doing it before it gets bad, but if it does get bad, then with the aid of x-rays, we make decisions as to whether or not teeth need to come out.
The scale and prophylaxis, can you do that without putting the dog under anesthetic?
Not to do a good job.
Right.
You know, some people use, if you have a very good dog, you can use hand scalers. Some people say that they can do a good job whenever the animals are awake, but you need to get right in under the gum line. And majority of dogs are not going to tolerate that.
I mean, I have to be under anesthetic when I get that thing done.
Exactly.
So I would imagine a dog with those big black, when their gums are black like that, like dogs have weird colored gums.
Some of it's natural. If you have a black lab, you'll have black gums.
And so it's not black that we're worried about?
It's not black, it's red. Because that's the inflammation of it. But there's a lot more hidden under the gums than what you can actually see. What you can see is only half the story.
Well,
the x-rays tell the other half.
Just like this tooth, right?
Exactly.
So you probably need x-rays and you may need some extractions.
So we need to scale and polish all the teeth to be able to probe them, to be able to tell how loose the gums are around them and whether there's any pockets being formed. And it depends on the state of the tooth, the size of the pockets, what the x-rays show us as to whether or not we have to take them out.
If you extract a dog's teeth, he feels better because the mouth pain is gone. They recover from that quite well.
After, you know, first week or so of natural healing, which would be the same as us if we had our teeth out, then they're good as new.
They're not
better than before.
Yeah, sure. And they don't need their teeth. They're not taking down a deer.
No.
At this point, they're not ripping and tearing.
No, dogs can cope with no teeth whatsoever. A lot of Yorkshire Terriers out there, or poodles, have no teeth because little dogs have much worse teeth than big dogs do.
That's typically when they get the tongue hanging out of the side.
That's if you've lost your canines, because your canines, as you've shown, are such a big part of the jaw.
That's what holds your teeth.
Exactly.
That's what holds your tongue in.
If you have a jaw, a skull of a tooth, a skull of a dog.
This is a replica, by the way.
Yeah. If you put the canine in there, this is probably a bigger canine than this skull is, but if you put that in there, it shows you just how much of the lower jaw that actually takes up. And so if you end up taking those two canines out, you're taking away a lot of the structure of this lower jaw, which we do not want to do. We want to prevent it from happening.
Yeah, I would think prevention is really important. So brushing your dog's teeth, having good things for them to chew on.
Dental diets are also ideal because they're kind of cleaning your teeth as you eat.
Right.
Because everybody has the best will in the world about brushing, but it doesn't always happen as frequently as it should. In an ideal world, dogs would have their teeth brushed daily. Twice a week is about as low a frequency as you're going to get some benefit. So having a dental diet or having gels that you can put on your teeth that help to lower the bacterial levels or make the smell not so bad, because that tartar trapping bacteria causes halitosis, which is the horrible doggy breath.
We've been talking about dogs and dogs' teeth. We've got a couple of minutes left. Let's just touch on cats here.
Okay.
Can we do the same thing with cats? Can we brush our cat's teeth just the same way?
But you have to have an even nicer cat than you have dog to allow them to do that.
So you really need to get your cat used to being picked up, held on its back, a lot of digging around in its mouth, and then just start with the finger.
Yeah, and there are little tiny brushes that you can get for cats that make your life easier. But a lot of people use the dental diets for cats rather than brushing just because they find it easier.
And that helps?
It does help, but they're not perfect because some animals chew on one side of their mouths, which means that they have beautiful one side and not so beautiful the other side. And that's why brushing is definitely number one.
And cats would need the same sort of veterinary intervention at some point if they've got bad teeth.
Definitely. Cats get the same stuff as dogs, but they also get something called feline odontoblastic resorptive neck lesions.
Sure they do.
Which are big posh cavities between their crowns and their roots, which there's nothing that can prevent, and they're really painful, and the teeth need to come out.
Okay.
So they're something you cannot stop happening.
Cats are okay if they lose their teeth too, right?
Absolutely.
Okay.
We don't take out any teeth that are worth having. So they're far better off without them.
Right, yeah, of course. Okay, well, let's if a dog needs his teeth out, or the cat, let's give him that new lease on life.
Exactly, it can make a huge difference.
It does. I've seen it, and we had Shih Tzus, and they ended up with no teeth, but they were pretty happy.
Exactly.
And they lived for a good long time. Dr. Jill Johnson, thank you so much for being with us. Dr. Johnson, our guest from the Country Hills Vet Clinic today. Hopefully we can maybe have you back on the program at some point to cover off some of the stuff we didn't get to, overweight and geriatrics and all that kind of stuff. Find us on Facebook, Critter Care with Robert Church. Thank you so much for joining us today. I hope that you get out there and you brush your dog's teeth. I'm Robert Church. We'll see you next time. This has been Critter Care on Shaw.
We are the voice of the community. We are its personality, its heart. We are Shaw TV.
Today on Go Calgary, we're in the southeast at the Calgary Food Bank. Yeah, it's all about hampers, volunteers, and what? Birthday rooms? Yeah, more from here, but also in this half hour, your chance to meet an aspiring songwriter. Also, discovering how to start your own business with pearls? And hear the touching story of an entrepreneur whose business is also an avenue for healing. This is Go Calgary. This is Shaw TV. This is great, amazing job, volunteers. And look at this board. These are all of, well, just a few of the volunteers that come here on a daily basis to the Calgary Food Bank. It's Phoenix for Go Calgary. Well, if you have this need to start a new business, you say, man, I want to do something that's just exciting in my life. Well, hey, here's 2.5 minutes of great information. Oh, where's Phoenix's? Oh, here it is. Okay, cool. I got that.
If you've ever been hassled by a boss or annoyed by a coworker, the thought of owning your own business has probably crossed your mind, which is exactly what happened with this man. After completing the hotel, restaurant, and management program at SAIT and working in the food industry for about 16 years, Dale Green decided he had enough experience to do it all himself.
I'm sure most people say, oh, if I ran the place, I'd do things differently, and so instead of just saying it, I decided to do it.
For Green, the decision was easy. He says mainly because he had the expertise, did his research, and didn't rush in with any unrealistic expectations.
I think the most important thing is to have a lot of experience in the industry that you're looking at. I knew exactly